Cardiologist and Director of Medical Affairs at Ulm Medical Center. Thanks for joining us today on Ulm Medical Center's Today's Health. We are here to give you the latest information on health topics so you can make decisions that are right for you and so that you can live your healthiest life. I'm here with Dr. Angela Hunstead. She's an orthopedic surgeon at Ulm Medical Center, and we're going to talk today about joint health. Dr. Hunstead, first of all, tell us a little bit about yourself.
Well, first of all, thank you for having me today. I'm very excited about this opportunity. But I grew up here in Ulm, was raised here, my family's still in the area, and then I did my undergraduate education, so got my bachelor's degree over at the college in Mankato, so Minnesota State University over there. Worked at Kraft while I was going through school, and then I moved away for a few years. So I went up to the U of M, or University of Minnesota, where I did my medical school training, and then I also did my orthopedic residency there, so the specialized training in orthopedics. Really enjoyed my time there. It was hard work, but really enjoyed it, but was very excited about the opportunity to come back to New Ulm. So something my husband and I have been looking forward to for the last few years. He's also from the area, grew up over in Lake Crystal, so his family is nearby as well. And then last summer we moved back to town. It's been a great experience for us, very welcoming community here, and really love my coworkers up at the hospital and the clinic, and patients have been great.
Well, good. I'm glad to hear that. We've really appreciated you coming back and offering what you do for our patients here. What I'd like to talk a little bit about today is joint pain, especially knee and hip pain. That's very common. Lots of knee and hip pain. You know, when someone's experiencing pain in their knee, pain in their hip, what's the first step for them? What's the first step in either finding the source of pain or figuring out how to make them feel better?
Right. I think one of the most important things that often gets kind of forgotten or you don't think as much about is the exam. So really taking a look at that knee or that hip, finding out how well it moves, the history from the patient. Did they have an injury, or is this something that's been slowly getting worse over time? That really points you in a pretty good direction of what's going on. And then we'll often use x-rays to confirm what we already suspect based on that exam and that history. Okay. I would say for things like arthritis type pain, which we'll often see on x-ray, further imaging like an MRI is rarely needed, but in some cases we do things like that if the diagnosis isn't clear. Okay.
You mentioned arthritis is a source of knee pain. What are some other sources of knee pain that people might have?
Yeah, so you could tear your meniscus. That's another thing that we commonly see. That's the extra piece of cartilage that's in your knee that helps to cushion the cartilage on the end of your bone. So it helps protect that other cartilage, helps to allow your knee to move smoothly. And so if you had an injury, you can get a tear there. That can cause you pain. It can cause trouble moving your knee. There's a similar piece of cartilage in your hip that's called the labrum, so that can also be torn in your hip and can cause similar things.
Okay, okay.
Other injuries would be tears to the ligaments. You can even have an injury where you damage the cartilage, not directly arthritis, but where you damage that cartilage. And so those kind of things would be treated differently than arthritis. There are also many tendons and muscles around your knee, so you could have an injury to those things. Sometimes it's an overuse injury, a strain or an issue where the knee or the joint just needs some rest and rehabilitation.
Okay, okay. So now as people age and they get arthritis in their knee, get arthritis in their hips, can get arthritis in different parts of the body. Often we think about replacing the joint. You're a surgeon, so when people think about coming to a surgeon, they think about surgery. But that's not the only option, may not be the first option. So what sorts of things do you tend to do? Do you look at? What do you try before getting to the point where you would replace the joint?
That's a good question. So as a surgeon, I am often thinking about surgery, but it's rarely the first thing I would try for an issue like arthritis. There are often many things we can do first, and none of these things that we have to offer reverse the arthritis or take it away. But when we get to the point of arthritis, we're really looking at treating symptoms, trying to get the person to feel better, get that joint to move better, be able to keep them active and doing the activities they enjoy. And so that varies. It's a little bit different for a knee versus a hip or a shoulder, but overall theme is the same. You know, one of the first things we'll do if it's kind of a mild pain is that you might take a medicine that you don't have to take every day, just on days where it's sore or maybe after you've been on your feet longer. And that's usually an anti-inflammatory. Now, not everybody can take those medicines, so sometimes that limits what we're able to do, or some people don't tolerate them as well, but in general they can be very good medicines. For knees, sometimes it's something like a brace, can give you that extra support, make your knee feel better, and help you stay active. There are other things like injections, and again, we have different medicines that we can use for injections in hips versus knees, but that can be very effective, especially in the knee.
Okay, so let's say you've been diagnosed with arthritis, and you've tried physical therapy, you've tried medications, you've tried injections, and nothing seems to help. Then what's kind of the final thing that you can offer?
Yeah, it's a little patient specific, depending on what their situation is, their health, what their x-rays look like, the degree of arthritis. But generally at that point, we're thinking about joint replacement.
Okay.
And what that is it's a surgery, and it can be a big surgery, but it can be a very successful surgery. And it replaces that cartilage or that worn out part of their knee with a special implant designed for this, and it's made out of a special metal and plastic.
Okay, okay. So we do that here at Ulm Medical Center, right? There are lots of places that this can be done around the region and the state. Why would someone choose Ulm Medical Center to get their joint replaced?
Yeah, that's a good question. I think we have a great facility here in New Ulm. I think we're very lucky to have it. We've got a nice OR, which is well equipped and well experienced in joint replacement, because joint replacements do require kind of an extra level of sterility and just being very proactive about that and being very careful with that, because if you had an infection in a total joint, in an artificial joint, it can be a very big deal for the patient. So we have processes in place. Our operating room staff is very familiar with that. We take extra steps to help prevent infections. We've got a great team of people in the clinic that are very experienced with preparing patients for their joint replacements, from our support staff in the clinic to our nurses to our medical providers that help with those medical evaluations ahead of time. Our physical therapy department works closely with us. We've got a very experienced physical therapy department with protocols in place for those joint replacements to make sure that our patients get the best function they can and the best recovery they can after their surgery.
Okay. So let's say that I've tried everything and we've made the decision that I need my knee replaced. And you mentioned that there's a lot of support at Ulm Medical Center to prepare me for that surgery. Can you talk me through what happens from the time that we've decided that I need a knee replacement to help prepare me for that eventual surgery?
Absolutely. So we'll talk to you about if there are any events coming up in your life or things like that where you maybe want to have your surgery done in enough time beforehand that you're recovered and able to attend to those things, or if you want to wait until after, if there's a family wedding or a vacation or something. Often people plan around those things, job situations, that kind of thing. So once you've chosen your surgery date, we'll set you up with several appointments. You'll meet with one of our nurses who will go over some education about the surgery, your date, when you come in, not to eat or drink beforehand. They'll give you all of those kind of instructions. They'll give you some scrubs, some special scrubs that you take home, and then you do those scrubs the night before surgery, and that's to also help prevent infection. They'll talk to you about what to expect. They'll ask you questions about what your home is like. Do you have stairs that you'll need to be going up and down? Do you need to make some adjustments beforehand? What's your plan for after surgery? They'll talk with you about those things. You'll meet with the physical therapist. They'll also talk with you about some of those things, about using a cane or a walker afterwards, about adjustments that you might need, a higher toilet seat sometimes, or a shower chair. Those are all things that they can help you coordinate ahead of time so you don't have surprises afterwards. You'll also meet with the anesthesia provider before surgery. So this is an appointment that's set up where you'll meet with these people and get your questions about those things answered. They'll talk to you about options. So you really feel prepared when you come in for surgery. Okay. You meet with usually your own primary care provider ahead of time. They know you the best, and they're able to really do a good medical evaluation, usually checking labs, sometimes an EKG, to make sure that medically it's as safe for you as it can be. Those are kind of the things leading up to the surgery. Also, when you meet with the therapy department, they will often give you some exercises to help you do ahead of time, to help strengthen your muscles around that joint, to also help with your recovery. Then when you come in for surgery, you come in the morning usually. You'll get checked in. You'll meet with a few more people that morning. You always have a chance to ask questions. So if anything comes up from the time the process starts right up until surgery, we always want to make sure you feel comfortable and you know what to expect. You often have a block especially if you're having a knee surgery. That's something that anesthesia providers do to help you with pain control after the surgery. It can be very effective. And again, they'll talk you through that when they meet with you ahead of time.
Okay.
Then after the surgery, you go up to our inpatient unit of the hospital. Most patients stay overnight, about 2 nights, but it's variable. You know, some patients are ready to go home the next day. Not everybody. I would say 2 days is about typical. Some patients stay 3 days. Some patients are ready to go home from the hospital. Some patients do need to go to a nursing home or a rehabilitation center for a short period of time before they're strong enough and able to be independent enough to go home, because it is a big surgery and it depends on what your home situation is like and if you have to do stairs and how much help you have at home. But while you're in the hospital for those few days, you work with our physical therapists, and they'll get you up moving shortly after surgery, so we really do emphasize that. I think it's really important. And the nurses will help out with, you know, making sure that your pain's controlled and helping you get up and get the things you need and monitoring your blood pressure and all of those things, helping you get around and teaching you and helping you learn what you need to do to take care of yourself when you do go home.
Okay, so it sounds like you would take care of me from the very beginning to the very end of the whole process.
Yeah.
So,
Yeah.
okay.
And then you would be seeing your surgeon back in clinic for
Okay.
follow-ups afterwards. And we do like to keep a good relationship, you know, stay in touch and do long-term follow-up, because if you do start to have any trouble down the road, we want to know about it and we want to take care of it sooner rather than later.
All right. Well, great. Well, Dr. Hunstead, I'd like to thank you for coming and explaining this to us today. If you have any and I'd like to thank you also, viewers, for watching us. If you have any questions about your joint health or joint replacement, you can go to our website, lineofhealth.org/New Ulm Medical Center, or give us a call at 217-5000 and ask for one of our orthopedic clinic coordinators.